Welcome back to San Diego People. Today we're focusing on cancer survivors, and I'm lucky enough to talk to a woman who beat ovarian cancer even when she was given just a 5% chance of survival. Her name is Cindy Silver. She's from South County. Thank you for being here.
Thank you.
It has been 8 years?
8 years since 8 years in March since my diagnosis.
Tell me what it was like to hear the words that you have ovarian cancer. It was stage 4 ovarian cancer and a 5% survival rate. That must have been an absolutely devastating day.
At that time, I didn't know I had a 5% chance. When I was told, my husband and I don't know why we thought this way. We were naive, but we decided we were going to beat it. So I didn't ask questions. I just decided I'm going to beat it. It was just in the last year that I found out I only had a 5% chance of living. So I'm glad I didn't know back then. I think I probably tried harder because I didn't know.
What, ovarian cancer, it's called the silent killer because the symptoms are so vague. In hindsight, were there symptoms?
There were absolutely symptoms, and a little later I'll probably talk about, I belong to an organization that is out there trying to get the symptoms out because there's very definite symptoms. Bloating, shortness of breath, difficulty eating, feeling full quickly, urinary issues. They're common. Women will say, I have all those. Yes, but with ovarian cancer, they don't go away. They just get worse. My bloating was so severe that I looked pregnant. And yet, I had no clue what it was. My mother and grandmother both had breast cancer. I didn't know I was at risk for ovarian cancer. Breast cancer is a risk factor. So the risk factors are important, but it's really important for women, if they have anything that's unusual going on for them, we say anything that's persistent, they need to see their doctor.
Once you were given the diagnosis, what was your treatment?
When I was diagnosed, I was so sick that my kidneys and liver were failing, tumors were blocking my bowel, so I was put on a food tube 24/7. In fact, I was so sick they couldn't even do surgery. So they decided to give me 3 months of chemo to try to reduce the fluid in my stomach, to try to reduce the tumors. And during that time, I lost 40 pounds. I couldn't eat. Went bald. I didn't mind that so much. I've always had sort of a sense of humor, so I named my tumors after people I didn't like. And I thought, visualize raisins when I'm through with them.
Did you do any alternative treatments?
I really didn't. I was so sick. But I just felt I was going to make it. I just can't explain that.
What do your doctors say? I mean, here you are 8 years later. What do they attribute your survival to? One
of my doctors, the one that diagnosed me, my GI doctor, I ran into him several years later, and he said, when you named your tumors after people you didn't like, I thought to myself, she's going to make it. The doctor that saved my life, Dr. Bahadur, Scripps, he has said, you're my miracle. You're why I do what I do. I love that man, as you can imagine.
Women, they go in every year for their annual mammogram or pap smear, but that does not detect ovarian cancer.
No,
what have you learned in hindsight? Is there a test on the horizon? Is there a blood test that you can take? Or is there any way that to make a definitive diagnosis?
There really isn't. When you have symptoms, then there's a series of tests they'll do. It has been suggested that you get a pelvic rectal exam when you get your pap smear, that can often detect it. Who wants to ask for that?
Right, right, yes.
But it might be life-saving.
And how has your life changed now that you are a cancer survivor?
It's so odd to say I am grateful for the cancer because I have met the most extraordinary women that are going through this, the most extraordinary medical professionals. And I've been able to join an organization called the Ovarian Cancer Alliance of San Diego, and we do patient outreach. We also...
is this the group here that we're seeing?
Yes, yes. This is our program, that's our HERE program. This is to women's organizations, civic organizations. We actually did a presentation at Scripps Hospital last year or somebody in the audience heard one of the symptoms, had it the next day, and was diagnosed with uterine cancer. So it's something, oh my gosh, that we're so excited about because women are becoming their own advocates now.
What is the average age? I know you're not a doctor, but
Yeah.
you sound like you could be one. What is the average age that a woman is diagnosed with ovarian cancer?
It keeps going down. It's 55 now, but a child as young as 8 has been diagnosed with it. I've worked with a lot of young women in their early 20s. It seems to keep going down. Every age should be aware.
Now, you are participating in the Survivors Day event on June 11th at Scripps. Tell us about that.
You know, Scripps has provided one of the most incredible things for us survivors, the GYN cancer survivors. We have a support group that meets twice a month, and most of us will be at the Survivor Day because we want to thank Scripps. It's a way of thanking them, but it's a way of getting together and not thinking about cancer, just having fun, enjoying the day. And I was the speaker there a couple of years ago. It was a very big honor. It's wonderful. It's so wonderful to just get together and laugh and not be talking cancer every minute.
Well, we want to show the information on where people can go to participate in this. And as we do show that information, is it open to anybody, any cancer survivor?
Absolutely. I thank Scripps always because they open it to everybody, not just to Scripps patients.
All right. Well, there's the information. It's happening Saturday, June 25th, and then Sunday, June 26th. There are a few of them. And I think I also mentioned the Survivors Day event on the 11th as well.
Yes.
Well, continued good health to you, Cindy Silver. Thank you for sharing your story. And, you know, you may have saved a life out there by someone who's watching. Appreciate it.
Thank you.